Good morning, my name is Maria Larrea and I will present about echinococcal cyst in the liver. Echinococcal cyst is a widely endemic hemolytic disease caused by infection with metastasis, the larva stage of the Echinococcus granulosus tapeworm. Also is called hiatic cyst. The two locations of this cyst are the lungs and the liver, but it mainly occur in the liver with a 70%. Also is a complex, chronic, and neglected disease with a worldwide distribution.
A liver cyst is a sac-like growth on the liver in which liver cells die or degenerate. These growths become fairly common with advancing age. A liver cyst is not generally considered to be a serious threat to health. However, it could be a clue that there's a more serious underlying liver problem like polycystic liver disease, liver cancer, or an Echinococcal infection which is caused by a parasite. The liver cyst and the Echinococcal infection. A cyst can also form on the liver from a condition called hydatid disease, which is caused by a parasite known as the Echinococcus granulosus worm. This is a tissue infection common in southern South America, the Mediterranean, the Middle East, Central Asia, and Africa. Cases have also been reported, though, in the United States in California, Arizona, New Mexico, and Utah. Humans can get this kind of liver cyst from eating contaminated food. Cysts can also form in other parts of the body, but they usually happen in the liver. This type of liver cyst may not produce symptoms for many years, but sometimes it can be diagnosed through a physical exam. Anyone who is exposed to cattle, sheep, pigs, or deer is at risk for contracting this kind of cyst. It can also come from exposure to the feces of dogs, wolves, or coyotes.
Applications in medicine. The transmission is by an infected animal feces. Humans are accidental intermediate hosts that become infected by direct contact with a dog or food infected by the feces. This disease is diagnosed by imaging techniques like X-ray, but also can be diagnosed with blood techniques like an hemogram. This image demonstrates an hiatic cyst in the liver in an X-ray. The symptoms of the hiatic cyst are first abdominal discomfort and pain. Also, it can cause a compress and obstruction of the bile ducts that lead in an obstructed jaundice. Also cause anorexia, pruritus, and in the case of a rupture or leakage of the cyst, can cause an immunologic symptoms like a response of the immunoglobulin E, allergic reaction. The most common are mucous membrane swelling, and in the worst case, a life-threatening anaphylactic reaction.
Hydatid disease is diagnosed with a combination of radiographic imaging and serologic testing. Ultrasound is widely utilized to screen for hydatid disease given its accessibility, ease of use, and relatively low cost. As a diagnostic modality, it has high sensitivity ranging from 90 to 95%, but its specificity is lower given that it can be difficult to distinguish hydatid cysts from benign cysts, abscesses, and neoplasm. However, presence of, quote, hydatid sand, the visualization of the protoscolices within the cysts, would certainly clinch the diagnosis. CT is a study of choice for hydatid disease. Not only does it have higher sensitivity ranging from 95 to 100% compared to ultrasound, but it is also better able to determine the size, number, and location of the cysts. If the etiology of cysts seen on radiographic imaging is uncertain, serologic testing for Echinococcal can confirm the diagnosis. ELISA can detect the presence of antibodies against Echinococcal with both high sensitivity of 94% and specificity of 99%. This CT image demonstrates a WHO stage CE1 hydatid cyst that is unilocular with an absence of daughter cysts. The CT image in the upper left corner shows a WHO stage CE2 cyst that is multiseptated with daughter cysts as indicated by the arrow. The plain radiographic image in the lower right corner demonstrates WHO stage CE5 dead cysts with calcified walls in the liver.
The treatment of these cysts are first of all surgery in case of patients with complicated disease. The main procedure is the laparoscopic. Also, doctors use chemotherapy with benzimidazole and albendazole. Also, they use PAIR, a percutaneous aspiration injection, and respiration. In terms of the pros, we have that most cysts in the liver do not produce the disease and maintain a balance between the agent and the host. And also, it takes many years to affect the organisms, and most are in an inactive stage. So the treatment is easier than the pulmonary cysts that are worse than in the liver. Then, in the terms of the disadvantages, the cyst in the liver can compress the bile duct and it can spread to the lungs. Also, leakage into the biliary tree can cause a secondary infection that, in the most of the cases, are worse. Also, can result in secondary idiopathies.
Treatment of hydatid disease is based on disease stage and cyst size. For inactive cysts, or CE4 through 5, no treatment is necessary and only observation is warranted. For active and transitional cysts without daughter cysts, or CE1 and CE3A, treatment is dependent on the cyst size. Albendazole alone is the only therapy required for cysts under 5 centimeters, while albendazole with puncture, aspiration, injection, and reaspiration, or PAIR, is necessary for cysts greater than 5 centimeters. Albendazole is dosed 10 to 15 milligrams per kilogram per day in 2 divided doses for 1 to 6 months depending on treatment response. PAIR is a percutaneous intervention where the cyst is punctured under ultrasound or CT guidance, its contents aspirated, then injected with a protoscholicidal agent such as 30% saline or 95% ethanol, and reaspirated devices. The image on the right demonstrates the surgical resection of a large mother and multiple daughter cysts from the kidney, and the left photo shows multiple resected hydatid cysts.
Echinococcal cyst is endemic in South America, with a percentage of prevalence of 20, but can go up to 95%. That means that South America has the highest prevalence, but also can occur in Asia, Africa, and Australia. In Ecuador, the INEC determined that this idiopathic 6 have a 6% of prevalence and mainly occur in rural sectors and in poverty. But in 2008, it was determined that there is a lack of information on data of this disease in Ecuador.
Echinococcal infection is distributed in South America, Europe, southern and central Russia, Central Asia, Australia, and Africa. The risk of infection is highly influenced by the extent and nature of human association with dogs. The parasite is widely prevalent in regions of the world where dogs are used to care for large flocks of sheep. This map illustrates the global distribution of both echinococcal species, with E. granulosus represented by regions marked in black and E. multilocularis marked with an X. Hydatid cysts are composed of 3 layers. The paracyst is the outer layer, consisting of modified host cells, fibroblasts, giant cells, and eosinophils, which together form a rigid protective layer and represents the host response to the parasite. The exocyst is the middle laminated membrane of parasitic origin, permitting the passage of nutrients from the host to the parasite. Disruption of this membrane predisposes the cell to degeneration, death, and bacterial infection.
In conclusion, echinococcal or hiatidic cysts are very common in South America, and most of it are located in the liver. This type of cysts are caused by Echinococcus granulosus tapeworm, and even though it takes years to produce symptoms, is very dangerous. In Ecuador, the prevalence is high, but there isn't enough information about this disease. So it's very important to inform people about the prevention methods of the echinococcal cyst to reduce the cases in Ecuador.
Prevention of Echinococcus is focused on disrupting the life cycle of the parasite. With respect to the definitive host, treatment of dogs with praziquantel has been shown to be an effective strategy. Additionally, adequate disposal facilities at slaughterhouses to prevent consumption of infected sheep viscera by dogs and minimizing the amount of stray dogs in endemic areas are important control measures that can be taken. With respect to the intermediate host, vaccination programs involving sheep and cattle against Echinococcus have been implemented with excellent results. Lastly, with respect to humans, washing fresh produce carefully and avoiding close contact with dogs can prevent accidental fecal-oral transmission of the parasite.